Welcome to the Kidney Support Network Volunteer Hand and Foot Massage Training. In order to complete the training, you will need to view the enclosed material and attend the practical session, which will include live demonstrations and hands-on training in massage skills. The video should be viewed prior to undertaking the practical component of the training. This video is divided into a number of sections. Section 1 provides some background on the development of hand and foot massage for dialysis patients. Section 2 provides basic information on dialysis for those who may not be familiar with it. Section 3 covers the high standards of hygiene required when visiting or working with dialysis patients and how we maintain those standards. Section 4 covers the procedures required when you attend the hospital or dialysis unit. Section 5 provides information on recognizing and responding to grief and loss issues among dialysis patients. This section also provides contact and referral information. Section 6 comprises a video demonstrating the techniques to be used when providing hand or foot massage. We'd like to thank all of those who have assisted in the development of this training resource, and our special thanks go to Bethel O'Keefe for her participation in the massage training video and for her continuing and unstinting support of the Kidney Support Network and other dialysis patients. You can use the control panel at any time to change the volume, access the table of contents, or change the screen settings. The Kidney Support Network was established in 2007 as an incorporated association with active branches and support groups throughout Queensland. Our services are financed through the fundraising activities of our members and volunteers, donations, grants from private trusts and government, community foundations, corporate sponsorships and bequests. The Kidney Support Network relies on the quality, commitment and endeavour of volunteers to provide quality support services for people affected by kidney disease throughout Queensland, and to encourage public awareness of kidney disease and increase support groups and branches. In recent years, a number of Kidney Support Network branches have begun to offer a hand and foot massage service for renal patients in the hospital units. The service provides patients the opportunity to enjoy a hand and or foot massage while receiving their treatment. This service is greatly appreciated by many of the patients as it can help circulation and also provide a relaxing reprieve whilst on dialysis. The service is provided by a dedicated team of volunteers and is aimed at improving the quality of life of those affected by kidney disease. We are aiming to expand this service in the future to dialysis units throughout Queensland. This training package will allow all Kidney Support Network massage volunteers to provide the same high quality service for all patients and dialysis services we work with across the state. In this section, we'll provide you with a brief overview and introduction to dialysis. In a healthy person, kidneys filter the blood to remove toxins and waste products. These toxins are removed from the body in urine. Kidney failure is the condition when patients' kidneys don't work anymore. Unless the patient can have a kidney transplant, the only way to prevent the toxins from building up to a dangerous level is to do regular dialysis. There are two kinds of dialysis: peritoneal dialysis and hemodialysis. Peritoneal dialysis uses a tube that goes into the patient's tummy and fills it with fluid every few hours. The fluid gathers the toxins from the body and then the fluid is removed and replaced by new, clean fluid. Peritoneal dialysis is usually done in the person's own home, but sometimes it's done with assistance in dialysis units. Most patients can do a peritoneal dialysis for a few years, but then it stops working. After that, they need to change to doing hemodialysis instead. Hemodialysis involves removing some blood from the body, cleaning it in a dialysis machine, and then returning it to the body. For this to work, the patient needs to have a fistula made in the arm. A fistula is a big blood vessel that is strong enough to handle having a dialysis needle inserted in it for a few hours at a time, a few times a week. Without a working fistula, patients cannot have hemodialysis. So it's very important that fistulas are kept safe and in good working order. For that reason, it's important that we never massage an arm that has a fistula in it. Some patients have old fistulas that don't work anymore, so it might seem like they have fistulas in both arms. Just ask them which fistula is the current one and avoid massaging that arm. Some patients have a device in their chest or groin that allows temporary dialysis to occur while they're getting a new fistula made. So occasionally you will meet dialysis patients who have no working fistula at all. Things to be aware of when working with dialysis patients. Some dialysis patients only have kidney failure and are otherwise fit and healthy. Others may have lots of other medical conditions, and these medical conditions can affect the circulation and nerve supply to the arms and legs. For example, some dialysis patients have diabetes. Diabetics often lose the ability to feel their hands and feet. This means they might have sores, ulcers, injuries, or infections on their legs or feet that they can't feel very well, or may not even be aware of. If these injuries get worse, it can lead to the amputation of the toes or fingers, a foot, or even a whole limb. Therefore, it's very important to ask the patient if they have any sores, injuries, or ulcers. It's also important to have a good look for any breaks in the patient's skin, sores, black or discoloured areas, or soft spots before starting massaging. If you find an injury, make sure that the nurses and the patient are aware that it's there. Do not massage a limb which has any injury, however small, as this may make the problem much worse. At worst, this could lead to an amputation. If you're not sure whether it's okay to massage a particular limb, ask the nurses. If the patient has no injuries to the skin or soft tissue, it's okay to start massaging. Be careful not to cause injury to a patient's skin or soft tissues by massaging too vigorously. Remember that it is possible that they may not feel their pain in their extremities, so be gentle. And stop massaging if the patient has any pain. Some patients with kidney failure have poor circulation. They may have a blocked artery in one or both of their legs. If you notice that a patient has very cold hands or feet, or that one hand or foot is much colder than the other, inform the patient of what you've noticed. It might be a long-term problem that they're already aware of, or it might be a clue that a new artery is blocked and that circulation to that limb is at risk. Let the patient and their nurse know when you've noticed this. The patient might need to be seen by a doctor. We're now going to look at the importance of maintaining hand hygiene and the risk of infection among dialysis patients. Modern medicine allows most infections to be treated with antibiotics. However, some bacteria have developed resistance to the effect of antibiotics. These are called multi-resistant organisms, or superbugs. Golden staph is an example you may have heard of. Common ones include MRSA or VRE. You may hear the nurses saying that a patient has MRSA or VRE. These are superbugs. Some dialysis patients have these bacteria living on their skin at all times. This makes it hard to treat them when they get an infection because the antibiotics don't work. It's very important that we do not spread these antibiotic-resistant bacteria from one person to another. We can do this by being careful in our actions, by always sticking to the 5 moments of hand hygiene. As a general rule, if you're not sure whether you need to wash your hands, then you need to wash your hands. It's also important that we look for contact precaution signs around patients. Even though they don't look sick, patients with these signs have an MRO living on their body. In order to prevent it spreading to other patients on our clothes and hands, we must follow the instructions on the contact precaution sign and wear personal protection equipment, PPE, whenever we are working with these patients, or indeed with any patients in dialysis. Usually, this will involve wearing plastic gowns and gloves. When offering the massage, we always wear gloves and an apron. PPE must be put on before you enter the patient area, worn throughout the encounter, and then removed when you leave the patient's bedside. If you need to leave the patient's bedside for some reason, such as to visit the toilet, you need to remove your PPE and put it on the bin provided, and then put new gear on when you return. Wearing a contaminated gown or gloves around the dialysis unit could spread the MRO to everyone else. And of course, after you remove your PPE, you must perform hand hygiene straight away. If you are massaging the hands and feet, you must of course replace your gloves, having completed the massage of the hands prior to massaging the feet, or vice versa. We've talked about the need for a high standard of hygiene when dealing with dialysis patients. Clean hands are very important in hospitals and dialysis units. As part of your training, you will complete the appropriate hand hygiene module at Hand Hygiene Australia. If you have already completed this, then what follows will act as a revision. For those who have not yet completed the module, the following will provide you with an introduction to hand hygiene. You will become familiar with the terms and guidelines related to hand washing. We encourage you to practice good hand washing techniques at home prior to your first visit so that they become easy for you to perform at the hospital. Remember that as volunteers we need to follow the same guidelines on hand hygiene that hospital staff do. Hand hygiene is another name for hand washing or cleaning. Hands can be effectively cleaned with either soap and water or with waterless hand sanitizer. Both are equally effective unless the hands are visibly contaminated, in which case hands must be washed with soap and water. It is an expectation that all volunteers frequently clean their hands. In hospitals, each time it is necessary for hands to be cleaned is called a moment. 5 moments for hand hygiene have been identified by the World Health Organization as the critical times when hand hygiene should be performed in hospital. These are 1. Before touching a patient. 2. Before a procedure, such as carrying out a massage. 3. After a procedure. 4. After touching a patient. 5. After touching a patient's belongings or surroundings, including tables, bedding, and clothes, etc. You will be wearing gloves when massaging a patient. Gloves are not a substitute for hand hygiene. Hands should be cleaned before putting on gloves, when gloves are changed, and after gloves are removed. New gloves are required for every patient. Why should you practice hand hygiene? There are many reasons. Bacteria can survive for days on patient care equipment and other surfaces. Any surface in the patient care environment may be contaminated with bacteria. Bacteria can easily be transferred from person to person or contaminated hands or equipment. It's important to practice hand hygiene after you leave the room, regardless of what you have touched. So let's look now at hand washing with soap and water when the hands are visibly soiled. If your hands are visibly soiled, you should use soap and water to wash them. This process should take between 40 seconds and a minute. Start by thoroughly wetting your hands. When your hands are wet, then apply sufficient soap to cover all surfaces of the hands, both front and back. With the palms facing each other, rub the hands together in a circular motion. Place the right hand on top of the back of the left hand with the fingers interlaced and rub vigorously back and forward. Repeat the process with the left hand on top of the right. Next, place the palms together with the fingers interlaced and rub from side to side as well as back and forward. Place the backs of the fingers on opposing palms and interlock the fingers. Rotate palms in opposite directions. Clasp the left thumb in the right palm and rotate the right hand. Repeat, with the right thumb clasped in the left hand. Clasp the fingers of the right hand and place them on the left palm, and perform a rotational rubbing motion while moving the fingers over the palm. Repeat the process with the fingers of the left hand on the right palm. Now rinse the hands thoroughly under running water. When the hands have been rinsed, they should be dried with a single-use towel, and use this towel to turn off the tap. Your hands are now clean. Hand washing with alcohol-based formulations. Alcohol-based hand rubs kill more effectively and more quickly than hand washing with soap and water. When using alcohol-based formulations, it should take between 20 and 30 seconds to wash your hands. They are less damaging to the skin than soap and water, resulting in less dryness and irritation. They also require less time than hand washing with soap and water. Bottles or dispensers can be placed at the point of care so they are more easily accessible. So the process involved is as follows. After applying the alcohol-based solution, the process is the same as when washing your hands with soap and water, but without the need to rinse and dry your hands at the end. Rub hands palm to palm. Place the right hand on top of the back of the left hand with the fingers interlaced and rub vigorously back and forward. Repeat the process with the left hand on top of the right. Next, we use the palm to palm with our fingers interlocked, moving vigorously from side to side and back and forward. Next, we place the backs of the fingers on opposing palms and interlock the fingers, as we did with the soap and water hand washing. Rotate each palm in opposite directions. Clasp the thumb in the right palm and rotate the right hand. Repeat with the right thumb clasped in the left hand. Clasp the fingers of the right hand and place them on the left palm, and perform a rotational rubbing motion while moving the fingers over the palm. Repeat the process with the fingers of the left hand on the right palm. Once dry, your hands are safe. If you bring any equipment with you, such as massage oil, it is important that it is cleaned between and before each patient. Equipment should be wiped down with disinfectant wipes. These come in white or green plastic tubs in the dialysis units and look like big wet wipes. The nurses may know them as Tuffy wipes. Equipment which cannot be cleaned, such as rugs or fabric, should not be brought to the dialysis units. Grieving and loss are often issues for those dealing with chronic illness such as kidney disease. The diagnosis and ongoing treatment of patients with kidney disease can at times result in periods of grief and mourning. It is important to remember that we are not trained counsellors. Our role is to support those on dialysis through conversation and massage. The most important thing to remember is that grief and loss are part of the human condition. Grief is natural and inevitable. Grief can affect every part of our lives. There is no right way to grieve. The responses to grief will differ for each individual. It's important to recognise that healing happens gradually. It can't be forced or hurried. Grief is a process, not an event. Grief reactions can include a wide range of emotions, thoughts, and behaviours. These can include anger, anxiety, a change in the worldview, how the person sees the world and their place in it, or their understanding of the world. It can result in changes in appetite, confusion, and for some people it can result in depressive episodes. We often think of grief as a strictly emotional process. But grief often involves physical problems, including fatigue, weight loss or weight gain, aches and pains, and insomnia. There may be many impacts to the individual of chronic illness, and this will vary from one person to another. It can affect their hope and hopefulness for the future. For some, it can also have an impact on their mental health. In particular, some of the social effects of long-term dialysis treatment can involve changes in the role as a family member. Because of the continuing need to attend dialysis units or to undergo dialysis treatment, there can be a heightened sense of social isolation. The time commitments for dialysis can have a huge impact on a person's life and lifestyle. There are a number of theories that have been developed to help us understand grief and bereavement and our reactions to them. The Kubler-Ross model saw grief as unfolding in stages. Under this model, grief was seen to have 5 distinct stages: denial, anger, bargaining, depression, and acceptance. However, rather than seeing that there are rigid stages of grief that people need to pass through, other researchers have suggested that it is perhaps more helpful to consider grieving tasks rather than stages. And the 4 tasks that have been identified in the grieving process are: 1, to accept the reality of the loss, to work through the pain and grief, to adjust to the new environment in which what we are grieving is missing, and to maintain an enduring connection to what has been lost while moving on. And we can see from this that grief is no longer thought of as a process. Grief and the grieving process is not static, and the person we are supporting may exhibit a range of emotions or responses. So now we look at how we can support the person who may be grieving. It's important that we accept and acknowledge all feelings. They're all valid and they're their feelings. It's important that we listen with compassion and listen in an accepting and non-judgmental way. We need to tolerate silences. Sometimes a patient will just want to sit in silence, and that's fine. We don't need to talk. We don't need to fill the silence with words. It's important for us to concentrate on listening carefully, because that shows respect and it also helps us to understand what's happening for the person. We are present for the person. We're not there to offer solutions, because we are not in a position to know the best options and the best solutions for that individual. And it's important that we allow people to grieve in their own way. Should a person be feeling angry because of their situation, it's important as well that we don't take this anger personally. It's not necessarily directed at us. Now some of the don'ts. Don't judge or admonish people that we're trying to support. Criticizing how an individual is grieving is insulting and demeaning, and may actually prevent them from engaging further with you. It's also really important that we don't try and fix. We're now going to talk briefly about amputation. Amputation is a source of grief. It's not unusual for patients that you will meet to have had a limb amputated. How individuals respond to their amputation depends upon their individual personality, values, attitudes, previous life experiences, their support system, and the meaning they give to their amputation. Some amputees may continue to have sensations or feelings that the limb is still there. Individual responses can vary. However, amputees who have experienced these sensations say it can feel like tingling, pressure, cold, wetness, itching, tickling, or fatigue in the limb that has been removed. Some people who have had an amputation may still feel the pain in the missing limb as if it was still there. Whatever their individual response or reaction to the loss of a limb, it's important to recognise that grief and the grieving process is a normal response to the loss of the anticipated loss of a limb. When providing massage to patients that have had an amputation, we should be particularly mindful of indications of concern such as coldness or discoloration in other limbs, and bring these to the attention of the patient and the nursing staff. It is normal for a patient to feel sad or numb or angry as part of their grief and grieving process. But as time passes, their emotions should become less intense as they come to terms with the loss. There may be many different reactions to grief. When these reactions continue over an extended period, or where they're interfering with the patient's otherwise normal functioning, it may indicate that they're unable to deal with these issues on their own and need professional support. If you're concerned about a patient, mention this to their nurses. Here is a short list of referrals that may be helpful to a person who is having difficulty. The first and obvious one is going to their doctor. But that's not possible. They can call Lifeline 13 11 14, which is 24 hours national number. Lifeline provides free telephone counselling and referrals. They also have an online service which provides access to a huge range of support services. Queensland Health now has a phone number, 13Health or 13432584, for all Queenslanders to help take the worry out of their health concerns. They can phone 24 hours a day, 7 days a week for the cost of a local call. Qualified staff will give the patient advice on who to talk to and how quickly they should do it. The advice here is confidential, qualified and supportive. Beyond Blue provides a wealth of information for people dealing with depression or having difficult issues in their lives, and they have a host of referral options as well. Salvo Careline provides counselling from the Salvation Army and is available 24 hours a day, 7 days a week. Men's Line Australia on 1300 789 978 provides professional support and advice for men 24 hours a day and 7 days a week. This concludes the grief and loss component of this training. We're now going to look at some of the dialysis unit procedures that you may encounter. Although different units may have some local requirements, there are a number of procedures that will be common to all units. The first is, you must wash your hands before entering the unit. Second, always check in with the shift coordinator or nurse unit manager before entering the dialysis unit. Ensure to wash your hands again before you enter the clinical area. That's the area where the dialysis is taking place. And at all times, be mindful that there may be some patients who may require regular attention, and so it is important that staff are not impeded in any way. Additionally, there may be people who may be particularly unwell today. Be sure to ask staff if there is anyone who should be avoided or not disturbed. When you've finished providing the massage, let the nursing staff know when you are leaving the unit. And after removing any PPE, wash your hands prior to leaving the unit.
Hi and welcome to the Kidney Support Network massage portion of this video. My name is Kat Keane and I'll be taking you through the sequence today. Before you get started, please ensure you've washed your hands correctly, you've applied your gloves and your apron. Before you massage, just check the skin over to ensure that there is no swelling, edema or any skin lesions seeable. And if you do note these areas, please consult and tell the patient and the clinic supervisor. You'll be massaging with the H2 oil lotion. Before you use this, however, please make sure you wipe it down before and after use. with is some nice gentle pump action to the shin, just to start the massage off. Following the pump action, we're going to go into a gentle squeezing and compression. Now, with time permitting, and if the skin allows, we can do this to the shin. Once you have squeezed the shin, come down to the ankle to mobilize the ankle. I'm going to place my palms either side of the ankle bones and then just rock gently side to side. Follow that with gentle compression over the foot and repeat. Rocking the foot side to side by cradling the ankle bones. Gentle pressure over the foot. Once we've done our pump action and our compressions of the shin and foot, we then apply the lotion. Just rub it in your hands a little bit to ensure it's a little bit warm. Apply this in long, broad effleurage strokes to the shin and foot. Just remember that time permitting and the skin allows, we can work our way up to the knee. We're now going to go with circular thumbs to the outside of the shin area. So circular thumbs are just kneading like this. Just make sure you're on the outside of the shin bone. Ensure when you start to apply pressure, you ask the patient how it feels. How does that feel?
Good.
Good? Excellent. Now as we work our way down, we come behind the calf and we gently strip the calf as we work our way back down to the ankle. We repeat. Circular thumbs to the outside of the shin, and then just kneading the muscle on the outside of the shin. Fingertips touch behind the calf and we move on down. Splitting the calf down to the foot. We come now to massage of the ankle. So what I'm going to do here is circular fingers around the ankle bones. Just nice and slowly. Now remember, time permitting, you can spend however long you wish. But to move on, we come to an ankle knead. So we're just going to pinch knead through the ankle region. So what I'm doing is I'm placing pressure on my thumb and on my finger and just pinching the skin. Apply some effleurage or broad compressions over the foot. Once the ankle pinch knead has finished, and we come to the massage on top of the foot. We're going to go into stripping of the metatarsals or stripping of the raise of the foot. So stripping of the raise, we're just applying reinforced pressure through the long bones of the foot. So we have a bone through here and a bone through here, and we're just going to strip between those two bones. When you get to the end, just roll and knead the foot and toe. Move along to the second gap. Just watch my thumbs. They're reinforced to add a little more pressure as permitting by your patient here. And just roll the toe, pinch knead the toe. And a little pinky one. Effleurage over the foot and repeat. So after the top of the foot massage, we just effleurage the foot with broad compressions. We then make a fist with one hand, and we place that fist where the toes meet the foot on the underside. Hand over the top, and we just curl the toes over the fist. And we just curl the toes over the fist. Then we come to the bottom of the foot massage. My hands go over the top of the foot and my thumbs remain underneath the foot. And all I do is crisscross the thumbs from the toes to the ankle. Don't be afraid to apply a little bit more pressure into this area. We do this 3 or 4 times. Once complete, effleurage the foot. And we go into fist rolling. For fist rolling, place one hand on top of the foot to support and just a light, loose fist with the other hand. You'll start at the heel, push up, and roll towards the ball of the foot. And roll towards the ball of the foot. Keep in mind, it's best to use your forearm on your knee just for a bit more support. And we finish up on one foot. We're just going to mobilize the raise of the foot or those long bones or metatarsals of the foot. So that's just a gentle rocking up and down. We then come to chafing of the foot. Support with one hand on the outside of the ankle. And almost like a knife, use your pinky side of your palm to work the inside of the foot. Gently rotate the foot 3 times one way. Please don't apply a lot of pressure upwards, just a gentle rotation. Go one way, come back the other way. Like we did earlier, mobilize the foot by cradling the ankle bones. Just some nerve strokes over the top of the leg and foot. Careful not to tickle your patient. And then just finish with gentle compression. And that commences one leg and one foot massage. Before you massage, just remember to wipe down the bottle before and after use. Ensure that the arm and hand you are massaging isn't the arm or hand with the needle or the fistula in. And again, just ensure that the skin looks clear, clean, and doesn't have any lesions. To start the hand and arm massage, we're just going to start gentle compressions over the lower arm and hand. Time permitting and skin allowing, work your way up to the elbow. After the gentle compressions, apply your lotion. Warm the lotion just in your hands before you apply. Holding the wrist, we apply long, nice effleurage strokes over the arm and over the hand. And just relaxing the arm. We'll just start with a one-handed C scoop. So you're going to hold with one hand the patient's wrist, and then just with a C-shaped hand, place the thumb on top and just provide some pressure through your thumb and your fingers on the top side and the underside of the forearm. And then cradling the arm, I'm just applying pressure down from the wrist to the elbow. To one side, turn the arm to the other side. We bring in the alternating thumbs to the bottom side of the arm and wrist. Just check in with the patient and the pressure. Turn the hand over and apply the circular thumbs to the wrist and forearm on the top side. Effleurage over the arm. Now we work the top of the hand. We're just going to slowly strip through the rays or the long bones of the hands like we did the foot. We're just going to roll out through to the fingertips. I just reinforce my thumb. Remember, we're doing this to make the patient feel good, so just nice and slow and relaxing. Effleurage over the forearm and hand, and we can repeat from the top. We turn the arm and the palm over. Now we work the palm side. It's just alternating thumbs into the meaty parts of the hand. Again, people like pressure in this area. Just ensure it's okay with your patient. Pressure okay?
Yeah.
Yeah. Then we move to stationary compressions. So it's a reinforced thumb, one thumb, other thumb on top, and it's a gentle pressure. There's no order of where to apply the pressure in the palm. Just make it even and throughout. People like pressure over the thumb portion of the palm. So again, maybe focus the compression in there. Yeah, it's nice. Just a little compression in there. Nice. Now on the palm side, we strip through the rays. And this time we're just going to pinch knead the fingers to the fingertip. Just reinforce that thumb as I strip through. And the pinky. Effleurage, and just squeezing, just compressions over the skin, forearm and hand. Add some nerve strokes here, especially if they don't tickle the patient. And then just gently compress the arm and the hand to finish. Time permitting, you can spend a bit more time in areas that you or your patient wishes, so you can repeat some of the sequence. That concludes our forearm and hand massage.